Well, welcome everybody and happy Colorado Gives Day. Just as a reminder, this is such a wonderful day for all of our nonprofits here in our community and throughout the state, as Colorado Gives Day really supports so much of the good work that we're all doing right now. We are so pleased to have all of you joining us and taking time out of your busy schedules today for this really important topic. I'm Debbie Pope, and I'm the CEO of the YWCA Boulder County, and I'm looking forward to taking us through this program today with just an incredible group of panelists, as we'll get to meet them in just a little bit. But let me start by just reminding everyone of the YWCA's mission. Our mission is to eliminate racism and empower women. We're focused on racial justice, economic advancement, and health and safety for women and girls. And we know in this current environment that we're in right now, it's really presented unprecedented challenges in all of these areas. So I want to thank you for being here today as we really start to dive into what is being called a Shecession. We have seen more than 2.2 million women leave the workforce between April and August, and we are already had challenges with the pay wage gap, affordable, dependable childcare, and support for women in the workplace. But when COVID-19 hit, women really started bearing the burden of the economic devastation of this. As I said, we're really fortunate to be joined by an exceptional panel of women today, and we will discuss some of the greatest challenges right now for women and what we need to look at and think about in terms of how we drive legislation, policy, and change to really disrupt this disturbing trajectory. Before we get started, though, as I said, our mission is to eliminate racism and empower women, and that means that we work toward right relationships with Native people. If we want to go to the next slide, Robin, that would be great. So today we acknowledge the Boulder Valley's history. In the words of Right Relationship Boulder, we want to acknowledge that the land where we live today is the territory of the Hinona-ai Arapaho people. We honor Chief Left Hand, leader of the last Hinona-ai band to spend their winters in the Boulder Valley. Many Hinona-ai people were massacred by the U.S. Cavalry at Sand Creek, Colorado in 1864. The survivors were forced out of Colorado to reservations in Wyoming and Oklahoma, where most Hinona-ai live today. In our daily lives, let us remember that the Boulder Valley is home to the Hinona-ai people and to many other tribes that also camped, hunted, and traded here for centuries. And the Native people of many indigenous nations live here today as well. So we want to acknowledge that. And now I'd like to move into our program today, and we're going to start with a Nightline sort of in-depth report that was done about a week and a half ago, really looking at specifically during this time how this is impacting women across the country. So we'll ground ourselves in that, and then when we finish with that video, we'll have an opportunity to talk to our panelists. So let's take a look.
For months, Katie Morales tried to make it work, caring for her 7-year-old daughter while also working full-time during the pandemic.
I had friends and family driving really long distances to come watch Genevieve for like a week or 2 weeks or a month at a time, also that I could keep doing this work that I loved.
Her job at an animal rescue farm.
The little baby love.
Not only a paycheck, but a passion.
Thanks, Nat.
But soon it became too much for the 33-year-old single mother.
I used up all my sick days basically in the first, 6 weeks of schools closing. And I think that if the choice is between continuing to take care of animals or taking care of my daughter, I have to choose my daughter.
She made the agonizing decision to quit her dream job.
It was a very sad day, again, because I just really took what I was doing seriously, and I really wanted to be there. You could say it's a personal choice, but it doesn't feel like one. If I had my choice, I'd still be working.
Katie moved across the country into her grandmother's home in Chino, California. 3 generations of mothers now keeping the family afloat.
It's not just moms, it's my mom and my grandmother. So it's generations back of women and mothers who end up being affected by this, because if I fall, who's gonna pick me up? My mom, like the same way I would for my daughter.
Katie is one of the nearly 2.2 million women who have left the workforce since the COVID-19 pandemic began, with another 1 in 4 women now considering either quitting or downsizing their careers.
Most economists are calling this the Shecession, if you will, because women are taking the brunt of the labor market damage from COVID-19. And this is for 2 reasons. One is because a lot of the industries and occupations that they work in have been hard hit by the pandemic. But the second reason is because of the lack of childcare and the disruption that daycare and school closures have caused.
And women ages 25 to 44 are almost 3 times more likely than men to leave their job because of childcare demands.
This is going to cost upwards of $700 billion this year to the U.S. economy in terms of lost productivity. That's 3.5% of GDP.
9 centimeters long.
Experts say even a short-term hiatus like Katie expects to do can have a lasting impact.
This is likely to set women back a generation, even if you will, in terms of what this means for women's progress in the workforce.
Even the women who have kept their jobs and have the flexibility to work from home are feeling the pressure.
Good morning. Just got up for the day. It's just after 5:30.
Holly Oakes has been working from home since March, balancing her demanding full-time job in Portland, Oregon, and helping her 2 kids, ages 10 and 12, with their remote learning.
I usually get about an hour or so of uninterrupted work time. So there is also the fun fact that my son is in band and they have to do it virtually.
Holly's husband works from home too, but she says she bears the brunt of the childcare.
Yes, sweetie pie.
Can you come make me lunch?
Oh, is it lunchtime already?
Yeah.
Okay.
There are so many women who tell me that they feel like they're failing everywhere. Work, there's just no way to possibly keep up with it.
Definitely. I think that is a great way of articulating it. I feel like we're doing so much. I kind of liken it to you're trying to plug holes in a sinking boat, and there's just so many that you can't plug all of them. I definitely feel like I'm failing in all areas.
Ready to go potty?
Holly's employer, a sportswear company, has been supportive, but it is still a challenge.
I recognize how lucky I am that I can work from home and, I don't have to go into an office every day or into the field every day. I also have a partner that I'm working with. I can't imagine what it would be like being a single parent, having to go into the field.
Single mother Angel Marino, a certified medical assistant in Detroit, has no choice but to keep reporting to her job at the hospital.
Even in this time right now with this COVID-19, I can't afford not to work.
Experts say the economic impact and stress of the pandemic has hit women of color hardest.
Many of those individuals are working in-person jobs, and so there's no working from home there. There's no shifting your hours around. And they also have less access to backup childcare. So they're less likely to have a nanny or a babysitter or someone else that they can turn to watch their kids so that they can get to work.
How have you been managing all of this?
Oh my goodness. It's just been very difficult since the pandemic began in March. And thank God I have a team, people I work with, my manager, my supervisor. They are very resourceful. They're trying to help me as much as I can get through this because they understand that I'm not alone in this. They also need people to show up to work. So it's been a challenge to keep going to work and prevent not being furloughed or fired.
Even before the pandemic, finances were tight for Angel and her 3 children, ages 10, 7, and 6, making their own hand sanitizers and masks. She never wants them to be homeless like she was as a child after her mother died.
And I want my kids to have stability.
In the spring, the hospital she works at was under siege.
How you doing today?
Doing well.
Angel was tested, worried that a positive result would keep her out of work.
Praying for good results.
The next day, a relief. She learned she was negative.
Such a beautiful day, and it just makes you miss all the life that was usually out here.
But childcare has been a harder problem to solve. In the spring, her children were in free daycare for essential workers, a lifeline funded for a time by philanthropies. In the fall, her children entered an in-person learning pod at their school. But just last week, Angel was informed it will be closing starting Friday because of rising COVID cases.
December 4th will be the last day and until further notice. So I'm assuming until next year. So from December, I'm going to have to really figure out this week what I'm going to do. I don't have too much support. My mom died when I was 2. My grandmother, her mother died of cancer a few years ago. It's like so hard to get a job and stuff and get somewhere. And then you get it. And then your kids or being able to be there for your kids or the choice of work and kids, it shouldn't be a choice. Like I want to be the best mom I can be.
The choices are impossible, and you're carrying the world on your shoulders.
But Angel has a hard-won resilience.
We can do it though. I was born for this. Like I was born to cross mountains.
Holding ourselves to a pre-pandemic standard is ludicrous. It's always going to be moms picking up the loose ends and tying them for people. Give yourself permission to leave some stuff untied.
I started at 16.
Back in California, Katie, still out of work, her 7-year-old daughter taking those virtual classes by her side, hopes this experience will teach her one of life's most valuable lessons.
I hope she learns how to be scrappy. I personally am not powerful enough to change the way the world operates around me. So all I can show my daughter how to do is change the way we operate within the world.
Shout out to the ones turning heads,
All right. Well, a powerful video, and I want to, while that is all fresh and we're sort of processing that, I want to go ahead and introduce our panelists. And I know, Robin, thank you so much. Our producer today will be putting up our screen so we'll be able to see each of them. But these names will probably, many of them sound familiar to all of you, but let me start with Casey Becker, who is the former Speaker of the Colorado House and our local representative for District 13. And there you are in both places. Casey, welcome. We're so happy to have you here today. I know this has been a busy time for sure. Angelique Espinoza, who's the chair of the YWCA Advocacy Committee, community activist and organizer extraordinaire here in Colorado and in our community. And then Catherine Bean, who's the Vice President of Public Policy and Advocacy for the YWCA USA. Hi, Catherine. She's an expert on federal policy and legislation that's really most impactful for women and for people in communities of color. And then Marta Locheman, who is our newly elected Boulder County Commissioner of District 2 and the first woman of color to hold this important position. So welcome, thank you so much. And we'll go ahead and take off the PowerPoint so that we can see everybody in full screen. So we'll there we go. Thanks so much, Robin. So let me just let those that are joining us today, please feel free to put your questions into the Q&A. We will be asking a few questions of our panelists first, and then I will be going to the Q&A and we'll be moderating those questions as well, because, oh my gosh, there's so much that we could dive into with this topic. And I know we only have a short amount of time, but I want to start with having each of you share, and this is going to be hard because I'm going to ask you to do this in like 30, 45 seconds, just your initial response to the challenges that women are facing and the current concerns in the state of the current state for women. So let me start, Casey, Representative Becker, with you.
First of all, thanks for having me. So I think the video really accurately highlights the impact that COVID has disproportionately on women and people of color. And at the Colorado legislature, we've been trying to respond to that with new legislation, trying to really stand up and help child care providers and get people assistance with rent and housing and utility assistance, because there's no easy answers right now. There are no good choices. Those of us who are moms and have kids to take care of and don't have a lot of childcare options, are forced to modify our jobs, quit our jobs, be in situations that we'd never ever planned on. Right? This whole pandemic is about adjusting to emergencies globally, but also in our own life. And so it's, we're doing what we can, but I think the video is absolutely correct about the impact that women face at a greater level than others because of the pandemic.
Yeah, thanks, Casey. And we're going to be touching a little bit more in a moment on some of the legislative items that are there to help in more depth. Angelique, what your sort of initial responses? I know we've been talking about this as an advocacy committee. Again, I know it's hard in 30 to 45 seconds to do that, but.
Well, what really strikes me is that these are stories that aren't that different than stories that could have been told before the pandemic. The system was already not working. It was already not working for women and people of color in particular. And the pandemic has just pressed on that fault line and made it even more challenging for people and caused these sort of catastrophic failures where there were smaller, more individual failures before.
Yeah, well said. Thank you. Catherine, I know you're looking at this from a federal, at a national level, your initial response.
I agree with everyone. I think that video was so powerful and so accurately captures the day-to-day challenges that many women face in their lives. Here at YWCA USA, we're really also paying attention to the intersection between access to healthcare, the economic catastrophe that obviously is having, this is called a Shecession because of the extreme impacts on women. This is the first ever Shecession where the impacts are so much greater for women than for men. 2008 was a he session. This one's about women and us getting, not choosing to leave the workforce, but really getting pushed out of the workforce by that combination of inadequate access to childcare because of COVID, because of financial uncertainties, because we're losing jobs. And then the thing that we're really paying attention to is that for women who are experiencing domestic and sexual violence, interpersonal violence in the home, there's no escape anymore. That these kinds of health crises coupled with economic challenges are like a petri dish in which gender-based violence can just blow up. Kids aren't having any safe escape from it, or the same safe escapes that they used to have in terms of being able to get out of the house to go to school, where a caring adult might be able to see what's happening to them and get help to the family, to the kids who are impacted, where the women in the home, if their husbands aren't working, the pressure's going up and he's also not leaving to go to work, so there's not a relief there. So that's an issue that is a part of what is fortunately becoming a told story, but still too often goes untold.
Yeah, thanks for bringing up and lifting up those other topics. I mean, there's so much in this we could cover today. Marta, initial response.
Yeah, you're right. 30 to 40 seconds for initial response.
That's okay.
But, I appreciate what Angelique said, which is kind of where, what I was sitting with while I was watching this video, is that we also have to remember that this country was really built on the backs of people of color historically. And so when I hear some of the comments about, women feeling like they're failing everywhere, I think for a lot of us in our communities, we've been feeling that for a really long time because of all of the significant pressures that women face. And we'll talk about some of those today. but really specifically women of color, and the expectations and the barriers that exist systemically. So yeah, thanks for inviting me, and I'm looking forward to the conversation and hope that folks participate. Jump into the chat. We really would like to have some dialogue today.
Absolutely. Well, so let's talk a little bit. Now we're going to jump into the space of like, what do we do about this? Where do we need to be in this space from a legislative and public policy? What can each of us do in that? And I want to start, we're going to start at the national level. So, Catherine, you touched on, there's so many different issues in this. I can't even imagine how to even start in that space in terms of, public policy and the legislature. But share with us a little bit about what you think is the most pressing legislation we need to focus on right now, and what you think will be coming. What do we need to be putting out there to be able to address this moving forward?
Great questions. I think here at YWCA USA, working with our network across the country, including Debbie, but also with partners here in DC, that collectively there's a sense that the COVID relief legislation is a very important area. Sorry, I've got a window that's giving me some issues with the lighting. A COVID relief package that actually directly addresses needs in the childcare arena, as well as needs for the nonprofit sector and for individual women is really important. And I just want to highlight a couple of things. The news coverage has really started to point out the impacts of the closures of childcare centers across the country, that between COVID safety issues and parental struggles financially, we've seen massive closures. In fact, 18% of childcare centers have been forced to close at some point during the pandemic, and 40% of the childcare centers in the US are not expected to reopen unless they receive public assistance, right? So having a big influx of money to stabilize the childcare system is absolutely critical. And we're talking at least $50 billion just to stabilize the sector for a period of 5 or 6 months. And it's got to be coupled with increases or an increased investment, and we're calling for at least $7 billion in childcare and development block grant funding within the COVID relief package, so that parents get the assistance they need to cover the cost of childcare, right? You're out of work, you're working fewer hours, you're having to pay out a greater percentage of whatever income may be coming in, you're impacted in your ability just to get to the job. And the significant impacts on women just can't be understated here, right? Childcare is a predominantly women-dominated sector. So when childcare programs close, it's women who are laid off, and it's women who can't get their kids into a program. All of that's exacerbated by school changes that mean, for my kids who might be in elementary, high school, or especially the elementary school years, past that infant, toddler, preschool years, where I expect to pay for childcare, all of a sudden I'm having to shell out for childcare as well. So we need robust funding for that. For the nonprofit sector, providers like a YWCA, like a YMCA, like Goodwill, like other programs that are meeting needs in communities, there's a lot of relief that's needed there, and we're advocating for that to be included in COVID relief. But all of that is an uphill climb. And then if you add in what women and families need just to make ends meet, right? Cash stimulus, extension of unemployment benefits, of paid leave, like the deadline that's available for you to have paid leave for COVID sickness, the moratorium on evictions, which is another crisis point that is caused economically, nutrition access, all of those things. The uphill climb is that the package that seems to be under debate right now is much smaller than is needed. Current conversations are around a $900 billion mark, which is like, wow, that's crazy, but it's far less than the $4 trillion that the House was initially talking about. And the investments in childcare that seem to be on the table, and we haven't seen the bones of the current compromise proposal that's coming out. If the studies are correct, what they're currently talking about, and we should know more later this afternoon, would only sustain childcare for 1.5 months. Right. So we're talking about a massively insufficient investment. So this has got to be taken up. It's got to be dealt with now in the lame duck session, and then moving forward into the next Congress that starts in January. COVID relief will need to continue. And we're going to be looking at, especially after we know the Senate parameters after the Georgia runoff in early January, we're going to be pushing for economic relief in things like paid family leave becoming permanent, right, for all workers, looking at equal pay issues, right? Colorado's been doing great work on that at the state level. We need that nationally. We need job training so that women can access higher skill, higher wage jobs that they right now don't have sufficient pathways to get into. And then you take the layoffs and the unemployment from COVID, and you've got ratcheted up considerations. The paper, the Shecession paper that YWCA issued in 2020 really talked about how this recession has fast forwarded what's called the fourth industrial revolution. So the movement that we thought we would have over 10, 20 years to get when people out of the service sector into this tech focused sector, all of a sudden that timeline is much collapsed, and all of a sudden it's here now. So there's a lot of work that could be done at a federal legislative level in the next Congress in order to try to create those pathways and really invest in that kind of those job on ramps in order to make sure that women can get to the jobs they need to take care of their families.
Yeah. I mean, there's so much, Catherine, right? So I know
my head's exploding.
We'll be doing a series of these, I'm sure, just because as we get into it. And I think that, as we're watching the federal relief package, and I know everybody, we're waiting to see what happens. I know a lot of states are already taking action because they just can't wait. I know New Mexico really just went in and put a package together, just knowing that they just couldn't wait. And Casey, Representative Becker, I know we just had a special session here in Colorado. So share with us a little bit about, I know that there's some strong things that Colorado is taking a stance in right now, but also what do we need to be thinking about, as Catherine was saying, as we look at the legislative session, coming up as well.
Sure. So we did just finish what's called an extraordinary session, a special session, really to get relief out to Coloradans across the state, because everything that Catherine's been talking about at the federal level hasn't happened. And I'll just start sort of explaining some of the statistics that we're facing here in Colorado. So we know that 10% of the state's childcare providers have closed their doors since March of 2020. And almost 3/4 of all childcare providers say they have or will have layoffs, furloughs, and pay cuts. And that's even higher for minority-owned or operated childcare providers. And more than 25% of existing childcare providers report that closure is imminent without some kind of special intervention. That's what we're facing on the childcare front. We also, we have increased unemployment, and we have a lot of people who are falling behind on rent. So just last week, the legislature met to spend about $350 million to about $45 million for child care assistance. We provided money for utility assistance, about $5 million for food pantry assistance, about $20 million to support school districts who are going to help people with broadband so that they can get better access for educating kids who are at home and using broadband. And then we spent about $100 million for small business assistance with a focus on restaurants and other retail providers. And then we spent a lot of money, about $100 million, to support the governor's efforts to do things like stand up testing sites and things like that. So, Colorado can't do everything. We, first of all, have to pass a balanced budget every year. And second, we can't print money like the federal government. So we have limited ability, but we did what we can. And I'm really proud of the work that we did. It was all very bipartisan, and it'll all get out pretty quickly, which is critical. I guess I just want to say, during this pandemic, the best way for us all to get back on our feet and support a thriving economy is to just defeat the virus. And so all of us, anything we can do individually to help our community stay safe is going to end up with all of us getting back to more normalcy. The next legislature will start January 13th. And the legislature, the Capitol building in Denver, on any given day has at least 1,000, sometimes 2,000 or 3,000 people in the building. And so we obviously can't do that in the pandemic. And so the legislature is going to have to figure out how to operate and how long to operate and how to stay safe. But coronavirus response is going to continue to be a top priority. I'm really happy that there was such strong bipartisan support for the $45 million we put into childcare. And I think it was about 10 million for utility assistance and just all in all, a lot of bipartisan support to step in where Congress hasn't been able to act. I guess I'd add one other thing that we did recently. I think Angelique is going to talk about some of the ballot measures, but in the last session in June, we passed paid sick leave. So that was not the law before, that you would get compensated for paid sick days. Oh, you get compensated for sick days. So up to 6 days a year. Every employer of 15 or more has to provide that starting in January. And then the following January, small businesses with 15 or fewer employees will have to provide paid sick days. Basically, you earn it at 1 hour for every 30 hours worked. So, those are some of the steps we've taken to provide assistance to families, everyone in Colorado really, with coronavirus relief. And I know there's more work to do. I know it's a drop in the bucket, but I think it's a pretty good first response.
Yeah, gosh, thanks so much, Representative Becker. And I think, everybody was, we have an early child care center here at the YWCA, Persimmon Early Learning, and have stayed open. We had about 6 weeks that we needed to be closed, but have been open through this. So all of the topics that you're bringing up, we can completely relate with, the families that we're seeing who need care, the affordable piece, really recognizing that many of those families seeing us right now are frontline workers, essential workers, and they need to have affordable, quality care. And when we close, just like the story showed, their jobs don't end, they have fixed schedules and everything too. So I'm really pleased to see, this is being addressed. And this has been an ongoing issue, to the point before all of this started, right? Angelique brought that up, Martha brought that up. And so it is interesting just to see, at least I guess the good thing is maybe that it's a conversation that's finally happening, even when it was an issue before. Okay, so Marta, now we're going to talk about bringing it down to Boulder County, as you're jumping into a commissioner's position. How does this translate for what we need to be doing here locally?
Sure. Yeah, and just to clarify, I'm still commissioner-elect. So
I'm sorry. Yes, we're moving you too quickly into your new role.
Yeah, it's all moving really quickly. But so I can't speak to positions on Boulder County until January. And that legislative agenda is being built right now and getting input from folks. What I do want to talk about is some of the work that I've been involved in the last couple of years preparing for this position. And one of those is with Childhood Care Council, Community Council here in Boulder County specifically. And one of the topics that we're really interested is around Family Friend Network. And what that means from a childcare perspective is really the family members who are participating in this, and even more so now with COVID, when we talk about multi-generational families, when we talk about undocumented workers who we still have not given the ability to work in this country, when we say essential workers are essential. And we've seen that even more so, obviously previous to, but now the light has been brought out about all of the work that our undocumented community members do. And we haven't come to a resolution that's, to me, a priority. And so I love hearing what Catherine and Representative Becker have talked about. And this is an item that has to be addressed. And the other pieces around our DACA families, nationally, look at the amazing and exciting change of events that will allow our families to start applying again for DACA. But my background is in home ownership. 17% of the 2019 sales around this country were of single women buyers. So my concern right now is also, and I haven't heard that, I've heard a lot about eviction and rent relief. But the other reality is that we have an issue around mortgages. We have an issue around people who need to be able to either refinance. We have an issue of people who opted in or applied for forbearance, who are now not able to refinance or to finance. And that is going to create a whole other ripple effect when we talk about this stability, economic stability. We're talking about all these women who aren't able to work. The fear here is, how do we manage those same women not losing their homes? Because is the way that people build equity, build capital, and truly jump out of generational wealth issues and the major inequities that we have in this country. And so those are some of the pieces that for me are really important. I also heard someone talk about career paths, which on a local level is something that I've been really interested in working on, talking about HR policies, talking about how we really bring people of color into the frameworks, but that also means that we change the systems and that we not just bring on a diverse workforce, but we know how to retain our employees. We know how to value our, for example, bilingual employees. We know how to pay for certified translators and interpreters, especially when we talk about federal funded programming that is also connected to these bills that were just discussed and the programs that were just discussed. And so that are some of those pieces of how do we really create communities that are not just reflective, but that are also not just supported, but that are welcomed, that are included, that are given decision-making voice. And so I know we're going to talk about that a little bit more, about the perspective and the reason why having women of color specifically in all these places is really imperative.
Yeah, and so let's just go there, Marta. I mean, I think it feels like it's an obvious question of why it's so important, but, share with us, of course, and looking through this lens and recognizing that, we have seen an increase at the, federal level in terms of women of color being elected. And of course, you now in your position and positions across the country like yours, but, why, tell us why, especially, it's always been important, but especially now, why do you feel like that lens is even more critical?
So I think I've heard a lot of folks talk about equity in a lot of different places. And the difference between using someone else's equity lens is when you allow people of color. For me to be the first Latina to sit in a commissioner's seat in Boulder County after 150 years of history now requires that the entire system also welcome that lens, and that entire system and entire community, that means 330,000 residents, say, yes, we're open to that and we are willing to do the work. Why is it so important to have people of color in decision-making roles? It's because the way that those decisions are made then appropriately reflect community needs. And I look at that from a women's perspective of all leadership roles, whether it's women in a boardroom who are cognizant of the same items that we're talking about this morning, about the multiple roles, the multiple hats, the multiple responsibilities, the unpaid labor that happens daily throughout the world by women when we are expected to also volunteer and do our job and take care of our kids and partners and et cetera, right? And so using those experiences by the folks who, quite frankly, we are the ones who are most dramatically affected by all of the inequities from the systems, and it's every sector. It is our financial sector, it is the industries, it's government agencies, it's all of the resource centers that actually should be supporting community members to go get the resources, especially when we talk about COVID-19. And all of those systems, unfortunately, are affected when people of color are not part of those processes. And so what that means is that then it creates benefits for community members to be part of all of those processes. And so decision-making has to include everybody who's also affected by, that cause and effect, right? And so when we're made up here by folks who aren't on the end of the receiving line, they don't know what happens really and what the effects are with those policies that are being made. So I think it's an exciting opportunity, and it's also something that we all need to be very vigilant about and not just talk about, but really make commitments to how we're going to make those changes.
Yeah, thanks so much. And you bring up such a great point, Marta, as we're talking about what can each of us do right now? What is our role in this? And I think you just gave a really good example of that, right? That in order to actually be able to have representation and equity in the community we say we want, we all have to do our individual part in that, in recognizing that we're listening, that we're listening and trusting, those voices that are being represented. So thank you. All right, so Angelique, and we do have some questions I'm going to jump to in just a minute, but we did have some successes, right? We have some things going on in Colorado, and one of them is family leave. So we've been working on family leave for, like we were saying, we've been trying to get this through, right? Every session that's been in place. And then to see that come through, a ballot measure that was approved in November, I think a lot of people were like, wow, that's great. What are some of these types of, ballot measures and things? What does that mean? And what do you think that really means? How is that going to translate for women and families?
Well, we had the YWCA of Boulder County took positions on 3 ballot measures, and 2 of them we were successful in our position, and they're both really impactful. So as you were talking about the paid family leave, which had struggled in the legislature to try and get passed, ended up on the ballot, and people said, yes, this is something we absolutely need. So it provides up to 12 weeks of leave, with an additional 4 weeks for a qualifying pregnancy or childbirth complications. Small businesses with fewer than 10 employees are exempt. The employers and employees have a 50-50 split on the contribution. And there are some other components in terms of who's included and who's excluded. But I think one of the really important parts of this is that the lowest income workers who would, if they were just receiving, 50 or 60% benefit, it would mean they're already at such a low level of income that getting that smaller percentage of that little tiny piece would just be unworkable. And the way this is organized, the lowest paid workers get 90% of their income as the benefit, and then it scales down as your income goes up, so that there's more equity for the people who are at the lowest income levels, which we know are disproportionately women and people of color. So that was just a huge benefit to families and women and people of color in Colorado. And I'm absolutely thrilled that it passed. To be honest, I didn't have much hope for it, but it passed. And not only that, but it passed very strongly.
Yeah,
which was really a powerful message to me that the broad public is seeing that this is a really important unmet need, and that it's valuable for us to address it.
Mm-hmm. So there's a few questions coming up. If it's all right, Angelique, I'm going to make sure that it's good. Everybody's really engaged in the conversation. There's a lot to cover. One thing, and I'm going to summarize this a little bit. One thing that does seem to be coming up is sort of, one of the questions is sort of like, what is one thing, the most important thing that we can do right now to advocate for women during this crisis? The other is for those that have more privilege, what is it that they can do, women who have more privilege, what can they do during this time to really make sure that, those women who are in situations where, they do need more support or assistance, what can their role be in that? So let me just let everybody absorb that question. It's a big one, but, kind of just trying to think about it. So maybe what we'll do is, Catherine, from looking at this, and advocacy from sort of this federal level, national level, what would you say is sort of that one, maybe one thing that you think could be very powerful for us?
Pick up your phone and call Congress. Even if your legislator or senator or rep already supports, what we want for COVID legislation, what's good for women, they still need to hear from you, because then they get to say, I'm getting overwhelming pressure from my district to do X. I'll put in the chat box a place where you can access. We've got an action alert up on including childcare providers, childcare support in the COVID relief package, and some stuff around nonprofits. You can take action on either of those. And I do believe that, out of probably 25 different leverage points that I could easily articulate, childcare is a central one, right? Because it's a women-dominated sector, as I mentioned earlier, and it is so critical for our whole economy to get back on track, right? We cannot do that without, and moms can't do that without childcare. They can't get back to work. And in terms of the privilege question, I think that recognizing that privilege puts on us a responsibility to actually be the ones to pick up the phone, to listen to Marta and Angelique and other women of color, and prioritize what they're telling us is important in their lives, and the way that they are describing the solutions that are needed. Whether they are in formal leadership roles, or they're neighbors in a community, or moms at school, that we have to take on. It's our responsibility. It's not a burden. It is our responsibility as good citizens, as human beings, to ask the question that says, what would really make a difference in your life? And then pick up the phone and make the call on it, whether that call is to Congress, or to KC, or to Marta, like at the state or the local level, right? That our responsibility as good human beings, as women, is to use our privilege of time, of resource, of access, to ask the question of, what do you need? Because I want to pick up the phone and make a call on that one, and put that ahead of what might make my middle class life even better. No, I'm gonna push for the things that are even more important for folks who maybe don't have as much power in the world, which is an unjust thing to begin with, but I need to prioritize that. So those are my best responses in the moment.
That's great, Catherine. And for those wondering, like you said, there's a link. There's also, we have an advocacy action alert program. So maybe a link in there
great
too, because I think sometimes it's like, oh my gosh, there's so many topics. How can I keep up with all the legislation? The YWCA really can do that. We're looking at it through that lens. So if you sign up for that, then you're going to be able to see those legislative priorities, and even what to say and who to call, and that type of action that's needed as well. Angelique, I'd love to hear just your response too, in terms of when we're looking at what do we need to do. And Catherine, I think you did such an eloquent job saying, what is our role as women in supporting all women in those issues. But anything else you might want to add, Angelique, even when we're thinking at a local, from a local perspective?
Yes. So many things. I'll try and pare it down to something that I think is particularly important. The YWCA Boulder County has a program called LAS, Latina Achievement Support. And it's a very successful program. There, we take a cohort of Latina high school young women and help support them through the process of applying to college, getting through those, those important last couple of years of high school, and getting into college. And because that's a huge lever of economic potential for economic advancement. So when I think of what people who are more privileged can do, I think, look for the programs in your community that are successful at creating more equity, more fairness in the world, and support those programs. We don't have to reinvent the wheel. There's usually, something going on that is successful and just needs a little more support to be able to scale up, for example. Mm-hmm. So that's
a great point, Angelique, because some of it is that, and today is Colorado Gives Day. So we have so many nonprofits doing really incredible work in this. obviously you're on a YWCA call. So, there's a lot of work that we're doing in this. And to your point, Angelique, even though we have a STEM E3 program for 5th through 8th grade girls of color that we really stood up last year. And that is that whole idea, how are we, I think it's easy to look short term with COVID-19 and be like, oh my gosh, how do we just react? And I think we also want to make sure that we're keeping the eye on the future. How do we keep these other programs going so that when we get on the other side of this, we already know that this opportunity gap is in place. So we don't want to, even make that greater, right? We want to make sure we're keeping those programs going and figuring out what's most needed, whether that's technology or, what are those resources that are needed for these young girls to be able to continue on those programs too. So great question. Catherine, thanks so much for putting that link for all of you in the chat box. And we'll make sure that there was also a question asking for the Shecession paper. So we can post that link. Thanks so much, Catherine, for all of that as well. One of the other questions that came in was really this idea, if you sort of had this magic wand and there weren't any obstacles or barricades, Representative Becker, what do you think is the most important, what would you do, with that magic wand related to this issue?
Sure. I mean, honestly, I think the magic wand would be getting a vaccine to everyone who can take it and defeating the virus immediately, because that's how we're going to get back to fuller employment and normalcy, kids back in school, people able to return to their jobs, all of that. I mean, I think that really is obviously the solution right now. But that, as everyone's pointed out, it doesn't mean women are immediately fully supported. It just means we're getting through this pandemic, because this pandemic has a bigger impact on women and people of color. So if it's, what's the one thing that we can do beyond the pandemic to support women and families? I think the National Paid Family Leave effort is, if we could just get that passed, I think it would go a long way in terms of a policy solution to support women. So, let's figure out the pandemic. Let's get Congress to actually act on pandemic relief, and then let's get paid family leave.
Yeah. Well, I like that magic wand. I'm sure all of you do too. I want to just take a moment and thank you so much for the time, all of you. This is just incredible. We could go on, I'm sure, for a much longer discussion. But I just want to take a moment to just go around our group and share with us how COVID-19 has personally affected you, and as a woman, and what you've seen this impact for each of you too. So Marta, let me start with you.
Sure. Yeah, there's so much to talk about. You're right. So that question specifically, it's been interesting for me because, I had a significant primary here in June, and then the general election, of course, November 3rd for everybody around the country. And I was also, during that time, I'm also a mother. I'm also a single mother. I have 2 boys. Both my kids lost their jobs. I lost my ability to work based on COVID restrictions in real estate in the state of Colorado. So as women, and it goes back to that piece of all of the pieces that we're already doing and all of the expectations, and I just happened to be working a full-time job. I was finishing a consulting project around translation and mental health care work and professional interpreters in instructional technology. So it was like perfect timing for the technology increase that we saw. And I was running a campaign. My campaign manager had to jump out of the campaign in March as well because of COVID and family requirements. So all of those different pieces. And then I think where most women can probably relate in some way, that when someone asks you, how are you today? Like, yeah, I'm good. And behind us, it's like that New Yorker magazine cover that you brought up before we went online is, here's everything else that is happening. And so I loved in the video, the comment that the woman said, I was born for this. And it's that positive messaging and that reminder of why we were also given all of the challenges that we are given as women is because this is who we are. And this is why, again, going back to your original question about why women in leadership is so critical for this, it's so critical for the ownership of business, why it's so critical for the ownership of property. I do want to just quick comment on one of the other questions, because we also have to acknowledge the educators around this country who have completely turned themselves up, down, and around and are continuing to build the future of our economy and our country, and they need to be paid appropriately, as well as our childcare providers. So I just want to make sure that we also acknowledge all their work outside of our frontline workers as well.
Yeah, Marta, thanks for lifting that up, because these women, and so many of them are essential workers and on the front lines, are also balancing all of the things that many of us can relate to. Representative Becker, I want to make sure how is this, you're you're in a huge position in terms of your role as the legislator, share with us a little bit about what this has been like for you.
I'd say just in a professional capacity, it was a lot of work to figure out how we needed to adjust our entire legislative agenda, our operations at the Capitol, our state budget to coronavirus. I mean, it happened so quickly for everyone. And we went out of session on March 14th and weren't sure, legally if we were even going to be able to continue a regular session. We knew we had to come back to pass a budget. We had to cut over $3 billion out of the state budget. We had to figure out, legally, could we let people participate remotely, legislators participate remotely? Could we keep people out of the building? And all of that was happening while there were major protests going on at the Capitol. So it was like one of the most tense, difficult things to cut the budget, to redirect the entire legislative priorities, to deal with the call for response to police brutality in a really short turnaround, and figure out exactly what we needed to do to get back in session, do that all very quickly, have new safety protocols in place. It was just pretty unprecedented. I think we did a really good job of responding quickly, and but it was tough. No one wants to cut state budgets like we did. I mean, we had to cut funding for K-12 and higher ed, and cut funding for human services, and just it was a very quick impact to the state. I'm glad at the time Congress did act to bring new money to the state and across the country. And so now we're obviously hoping that happens again. And then, I had 2 kids at home, and my husband was amazing to step up. Right now they're in 4th and 7th grades. And, I think everyone's learning to adjust. None of it's easy. And we're going to learn down the road what the longer term impacts are. There's a lot of impacts to kids right now, and not being able to be social, not doing sports, not hanging out with their friends. There are impacts to obviously people who are having direct impacts of someone passed from COVID. It's just going to be, a lot to learn from as we move forward. But in the moment, I think we did a pretty good job of responding as a state to incredibly changed circumstances, getting a whole lot of relief out quickly, and getting the Capitol back up and working, which was
no small feat. No, it's really.
It was like all the things we had to solve so quickly, while not even being able to be in a room was unprecedented. But I think we got through it.
Yeah, gosh, thank you. And we're running short on time. We're actually at our time, and I know, gosh, Catherine, Angelique, I know both of you also have had, a lot that you're balancing during this time too. But Representative Becker, thank you, because I know that it has taken, it's really hard to lead through this time that was, unprecedented, and, there's a lot. So thank you so much. And thank all of you, the panelists, for being here today. Next time I'm going to schedule this for much longer if you're all open to it. So we'll be continuing. The YWCA will still be doing ongoing programming of This Is an Issue that we're, continuing and will be continuing to deal with. So we'll be bringing incredible women like you've had today together to continue this conversation as well. And just want to thank everybody and all of you who joined us today. Please take advantage of those links that are in the chat box. And of course, Colorado Gives Day, just reminding everybody how to support your community as well. So thank you all so much. Everyone have a wonderful day and safe and healthy holidays ahead of us.
Thanks, everybody.
Thank you.